Every year, nearly 1.5 million men are diagnosed with prostate cancer worldwide. It is the second most common cancer among men, and while treatments have improved significantly over the years, prostate cancer remains a serious public health concern. For many men, the biggest challenge is not the treatment itself, it's catching the disease early before it spreads. The earlier prostate cancer is detected, the better the chances of survival. In fact, the 5-year survival rate for localized prostate cancer is nearly 100%, but once it spreads to distant organs, that rate drops drastically. So why aren't all cases caught early? The problem lies in traditional screening methods. The most commonly used test, the prostate-specific antigen, PSA test, measures the level of PSA in the blood. While it has been a valuable tool for decades, it has limitations. False positives can lead to unnecessary treatments, causing anxiety and physical side effects for men who may not even have cancer. False negatives mean some cases go undetected for too long, allowing the cancer to progress before it is diagnosed. This means that some men undergo unnecessary biopsies and treatments, while others may not receive the care they need until it's too late. But here's the exciting part. Science is advancing rapidly, and new technologies are emerging that could completely transform the way we detect and treat prostate cancer. In this video, we'll break down 4 major breakthroughs that could save lives, improve treatment outcomes, and give men better options for fighting prostate cancer. Let's get into it. Breakthrough number 1, AI and early detection. Smarter screening saves lives. Imagine a world where artificial intelligence, AI, helps doctors detect prostate cancer faster and more accurately than ever before. That future is already here. AI-powered imaging is revolutionizing how doctors analyze MRI scans and pathology slides, helping them spot cancerous cells that even experienced specialists might miss. Studies show that AI-assisted diagnostics can reduce misdiagnosis rates by nearly 30%, leading to more accurate screening and fewer unnecessary biopsies. AI can distinguish between aggressive and slow-growing tumors, helping doctors decide whether treatment is needed right away or if a watch-and-wait approach is safer. AI can help predict which patients are at higher risk of progression, guiding doctors in choosing the best treatment options. The FDA has already approved AI-powered screening tools, and hospitals worldwide are beginning to integrate them into routine cancer care. This is a major breakthrough because prostate cancer can be tricky. It often grows very slowly, but in some cases it can become aggressive and life-threatening. With AI, we can catch cancer earlier, reduce unnecessary treatments, and improve survival rates. Breakthrough number 2, precision medicine and genetic testing. Tailored treatment for every patient. What if your treatment plan was customized specifically for your body and genetics? That's exactly what precision medicine is doing for prostate cancer. Doctors now analyze a patient's genetic makeup to understand how their cancer might behave. This allows them to create personalized treatment plans instead of using a one-size-fits-all approach. One key development in this field is genetic testing. Scientists have discovered that some genetic mutations, such as the BRCA1 and BRCA2 genes, which are commonly associated with breast cancer, can also increase the risk of prostate cancer. Here's why this matters. Men with specific genetic mutations may need more aggressive treatment to stop the cancer from spreading. Genetic testing can help identify men at higher risk so they can start screening earlier. Some prostate cancers respond better to targeted therapies, which are more effective and cause fewer side effects compared to traditional treatments. With genetic testing, doctors can predict who is more likely to develop prostate cancer and choose the best treatments for each individual, leading to better survival rates and improved quality of life. Breakthrough number 3, immunotherapy and new drugs, supercharging the body's natural defenses. For years, chemotherapy was one of the primary ways to treat advanced prostate cancer. The downside? Harsh side effects, including fatigue, nausea, and damage to healthy cells. Now, researchers are turning to immunotherapy, a treatment that harnesses the body's own immune system to fight cancer. One of the most promising immunotherapy drugs is pembrolizumab, which is being used to target aggressive prostate cancers that don't respond to standard treatments. This therapy teaches the immune system to recognize and attack cancer cells rather than just killing cells indiscriminately like chemo. It has shown remarkable success in clinical trials, especially for patients with specific genetic markers. Immunotherapy is providing new hope for men who previously had no treatment options left. By boosting the body's natural ability to fight cancer, immunotherapy could revolutionize how we treat advanced prostate cancer in the coming years. Breakthrough number 4. Non-invasive treatments. No surgery, no long recovery. For decades, surgery and radiation have been the go-to treatments for prostate cancer. While effective, they often come with significant side effects, including urinary and sexual dysfunction. Now, non-invasive treatments are emerging, offering men new, less painful options for treating prostate cancer. One of the most exciting innovations is MRI-guided focused ultrasound. This procedure uses high-frequency sound waves to destroy cancerous tissue without surgery. It targets cancer cells with extreme precision, reducing damage to surrounding healthy tissue. Best of all, patients can go home the same day with minimal side effects. Another major advancement is proton beam therapy, which delivers high-energy particles directly to the tumor, sparing healthy tissues from radiation damage. These non-invasive options mean that men diagnosed with prostate cancer in the future may not have to undergo risky surgeries or harsh radiation therapy. What this means for you, how to take action. So what does all of this mean for you or someone you love? If you're at risk for prostate cancer, talk to your doctor about AI-assisted screening and genetic testing. If you or a loved one has been diagnosed, ask about the latest immunotherapy treatments and non-invasive options. If you want to be proactive, stay informed, and watch for clinical trials that offer access to groundbreaking therapies. The future of prostate cancer treatment is changing rapidly, and these innovations could mean longer, healthier lives for millions of men worldwide. Final thoughts and call to action. If you found this video helpful, hit that like button. It helps spread awareness. And if you want to stay updated on the latest medical breakthroughs, hit subscribe and turn on notifications so you never miss an update. And most importantly, share this with someone who might need to hear it, because you never know whose life this information could save. Stay informed, stay healthy, and I'll see you in the next video.